Today's topic of discussion is going to be on restraining devices. Hi, I'm Kathy Getrust, and I'm an instructor in community health. What are restraints? There are two main kinds of restraints. The first is physical restraint. A physical restraint is defined as any device attached or next to a patient's body that an individual cannot remove easily, which restricts freedom of movement and normal access to the body. That's a mouthful for a definition, but a shorter one is that a restraint is anything that a person cannot get out of on their own. Another type of restraint is chemical. A chemical restraint is any medication given to control a patient's mood or behavior. As a caregiver, you will be more involved in physical restraints, and as a result will be the focus of the rest of this tape. Federal and state laws specifically address the use of restraints in facilities. The Omnibus Budget Reconciliation Act, or more succinctly called OBRA, is a federal law that has brought about changes to the use of restraints in long-term care. The Joint Commission on Accreditation of Healthcare Organizations, also called JCAHO, is another federal organization that guides the use of restraints in hospital settings. These and other laws, such as the Patient's Bill of Rights and public health codes, expect that those of us who care for patients to continually strive to find ways other than the use of restraints to resolve problem behaviors whenever possible. Why are restraints used? Well, there's a number of reasons. One is it's for the prevention of falls, which can result in serious injuries or possible death. Prevention of injury or to self or others is another reason why restraints are used. That can be injury due to aggressive, combative behavior, such as pulling out intravenous, called IV lines, or other tubes. Positioning aids are another reason why restraints are used, to help maintain good alignment and positioning for the patient. This may, for example, help patients to sit upright in a chair without sliding down or slumping over to one side. Important to remember, though, that restraints are never to be used to make an uncooperative patient mind. They are never used for the convenience or benefit of the staff. What are some benefits of using restraints? Well, it may enable a patient to do more for themselves. For example, a bed rail may allow a partially paralyzed patient to turn over on their own. May protect the patient during treatments. For example, a patient may need an antibiotic or other medication given intravenously for a very serious condition. A patient that picks up the IV or pulls out an intravenous line or other tubes may need to be restrained so that they can receive the treatment that they need. It may keep people from injuring themselves due to falling out of bed or out of a chair. However, studies have shown that although the number of falls increased slightly when restraints are not in use, serious injury declined. In many instances, there are more hazards than benefits associated with the use of restraints. Complications of immobility is a big one when the patient is tied down, limiting their ability to move about freely. Some of these complications of immobility are weakened muscles and loss of calcium from the bones that make their bones brittle and easily broken. Another complication of immobility is pressure sores or other skin irritations from being tied down and in the same spot for too long. Also, immobility causes patients to have increased problems with incontinence of urine and stool because the patient cannot get up and go to the bathroom. Constipation is another problem of immobility from limited activity and the patient suppressing their urge to have a bowel movement. Another problem is increased agitation that some patients experience by their resisting the restraint and struggling to get out of them. Depression is another hazard of the use of restraints. Depression from lack of social stimulation and a sense of helplessness being restrained. Reduced social contact is another hazard with restraint use, with less participation in activities and other changes that affect their quality of life. There are also numerous documented cases yearly of deaths that have resulted from restraint use. These deaths usually happen from strangulation, from getting entangled in the straps as the patient slides down in the chair or topple over the bed railing. And you need to understand how it might feel from a patient's perspective to be restrained. Patients describe it in many ways. Some of the comments that we've heard is that it is emotionally demoralizing for them. Some talk about it having a loss of human dignity. Specific comments such as, "I'm treated just like a baby," or "Why am I being punished like this?" or "Can't I be trusted at the age of 85?" all speak to the loss of human dignity that patients perceive when they are in restraints. You can see, therefore, that the decision to use restraints is a very serious one and is not to be taken lightly. There are specific patient policies that need to be in place whenever using restraints. A physician's order must be obtained by the nurse when restraints are to be used. The physician and the registered nurse decide on the type of restraint to be used and the length of time that it will be in place. Always, the least restrictive method of restraint that meets the patient's needs is applied. Only commercially designed restraints may be used. That means it would not be acceptable to roll up a sheet and tie it around an individual while they're sitting in a chair. Continually, we are responsible for looking for ways to find alternatives to the use of restraints. And remember, most of all, that restraints are to be